Cerebrovascular accident, the basics. A stroke or cerebrovascular accident is defined as an abrupt onset of a neurologic deficit that is attributable to a focal vascular cause. Acute stroke is characterized by the rapid appearance of a focal deficit of brain function, usually within minutes, most commonly a hemiplegia with or without signs of focal higher cerebral dysfunction, such as aphasia, hemisensory loss, visual field defect, or brain stem deficit. Classification. Pathological classification. Strokes can be classified, mainly as ischemic, or hemorrhagic strokes. Ischemic strokes can be embolic or thrombotic. Hemorrhagic strokes can be intracerebral hemorrhage or subarachnoid hemorrhage. Intracranial hemorrhage is caused by bleeding directly into or around the brain. It produces neurologic symptoms by producing a mass effect on neural structures from the toxic effects of blood itself, or by increasing intracranial pressure. The major cause of intracerebral hemorrhage is hypertension, while that of subarachnoid hemorrhage is aneurysmal rupture, especially aneurysms located at the circle of Willis and its main branches. Strokes may also be classified as focal or global, depending upon the area involved. Clinical classification is based on duration and evolution of symptoms. Transient ischemic attack or TIA. The definition of transient ischemic attack requires that all neurologic signs and symptoms resolve within 24 hours without evidence of brain infarction on brain imaging. Stroke. Stroke has occurred if the neurologic signs and symptoms last for more than 24 hours or brain infarction is demonstrated. Progressing stroke or stroke in evolution. This describes a stroke in which focal neurological deficits worsen after the patient first presents. Such worsening may be due to increasing volume of infarction, hemorrhagic transformation, or increasing edema. Complete stroke. This is rapid in onset, with persistent neurological deficit, which does not progress beyond 96 hours. Reversible ischemic neurological deficit. In this, the neurological deficit completely resolves within a period of 1 to 3 weeks. Risk factors or causes. Inquire about the patient's age. Stroke is more common after 60 years of age. Gender. Males are usually affected more than females, except in the very young or very old. Ask about past and current medical history, history of various diseases, such as hypertension, diabetes, hyperlipidemia, previous vascular events, for example, myocardial ischemia, stroke, or pulmonary embolism. Also ask about the history of heart diseases, such as atrial fibrillation, heart failure, endocarditis, dilated cardiomyopathy, vasculitis, such as polyarteritis nodosa, Wegener's granulomatosis, Takayasu arteritis, etc. Ask about excessive smoking and alcohol consumption. Other risk factors include protein C and S deficiencies, high fibrinogen levels, etc. Clinical features. The clinical manifestations of stroke are highly variable because of the complex anatomy of the brain and its vasculature. If the cessation of flow lasts for more than a few minutes, infarction or death of brain tissue results. If low cerebral blood flow persists for a longer duration, then infarction in the border zones between the major cerebral artery distributions may develop. In more severe instances, global hypoxia ischemia causes widespread brain injury. The constellation of cognitive sequelae that ensues is called hypoxic ischemic encephalopathy. General signs and symptoms include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Nearly 85% of ischemic stroke patients have hemiparesis. Drooping of face, or difficulty in swallowing. Sudden confusion, inability or difficulty talking or understanding speech, dysarthria, abnormal drawing or copying, aphasia, and topographic disorientation. Inability to see, or change in vision, in one or both eyes. Difficulty in walking, abnormal gait, sudden falls or drop attacks, vertigo, tinnitus, diplopia, nystagmus, dizziness, loss of balance, and lack of coordination. Sudden severe headache, with or without vomiting, loss of consciousness, seizures and coma. In the pre-hospital phase, Cincinnati Pre-Hospital Stroke Scale, in which the acronym FAST is used, which stands for facial weakness, arm weakness, speech abnormality, and time of onset of symptoms. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.